A drone shot flying through smoke emitted from industrial chimneys is shown.
This video is about air pollution. It will cover the sources of indoor and outdoor air pollution, how air pollution impacts our health, how to adopt safer behaviours to protect yourself from indoor air pollution, and where to get support to improve indoor air pollution. What is air pollution? Air pollution occurs when harmful gases and dust are released into the environment, changing the quality of the air we breathe. While most air pollutants are invisible, we can sometimes see large concentrations of it being emitted from chimneys in industrial cities or from car exhausts. There are many different types of air pollutants, but the ones most harmful to our health are nitrogen dioxide and particulate matter. A huge 51% of our nitrogen dioxide pollution comes from our transport systems, including road traffic, boats and rail. The rest comes from our industry, energy generation and household burning. Nitrogen dioxide is not only an outdoor pollutant, it can be found inside buildings through unvented combustion appliances such as gas stoves and tobacco smoke.
An image of an industrial site with many chimneys is shown, followed by an image of smoke coming from house chimneys in winter.
Particulate matter pollution is emitted by manufacturing and industrial sites, but the second largest contributor is from household burning of wood and coal.
Images of a volcano, a wave crashing against the shore, pollen being blown from a plant, and some power station cooling towers are shown.
Particulate matter pollution outdoors can be produced naturally from volcanoes, sea spray and pollen, as well as being man-made. Indoors, our activities such as burning wood, candles and using certain solvents and beauty products can increase how much we are exposed to particulate matter pollution.
The top of an industrial chimney emitting lots of smoke is shown. Within the smoke are skull and crossbone icons.
Why does it matter? Research tells us that there are no safe levels of air pollution, and any exposure to it can be harmful to health, shortening our lives and reducing healthy life years.
An image of a street crowded with people is shown, followed by an image of an older man taking an inhaler.
Air pollution affects everyone, but some people are more vulnerable to its effects than others. This includes older people and specifically those with a long-term health condition, such as a lung or heart problem, including chronic obstructive pulmonary disease, asthma, or coronary heart disease.
An image representing dementia is shown.
New research also suggests air pollution can lead to memory decline and dementia.
The image of a street crowded with people is shown again, this time with a silhouette of a person with an airway and lungs. Animated bubbles represent the person breathing in. Their lungs change to show damage and veins appear across their chest.
When we breathe in polluted air, the particles can get stuck in our lungs, or in some cases, if they are small enough, they pass through the lungs and into the bloodstream. Air pollution can irritate our airways and irritate any lung illness that we already experience. On days where air pollution is high, we may find that we are coughing or wheezing more and may feel like our eyes and nose are irritated. We may feel shorter of breath than usual and need to rely more than normal on inhaler medication to manage our condition. When pollution levels are high, there are more admissions to hospital by people with lung conditions, including asthma.
An image of cars stuck in traffic emitting exhaust fumes is shown. This is followed by an image of a woman and two children on a sofa.
Understanding air pollution. We often think of air pollution being something that affects us when we are outdoors, from traffic and industry, yet many pollutants are also found in our indoor environment, where we spend approximately 90% of our time. Pollution indoors can come from a number of activities, such as cooking, cleaning, drying clothes, burning wood or candles, and using certain personal care or decorating products. Breathing polluted air indoors can make symptoms of heart and lung conditions, as well as allergies, worse. Here are 10 top tips to improving air within the home. Our top 10 tips to better indoor air quality. 1. Let in fresh air by opening your windows a few times a day, if it is possible and safe to do so. This releases stale air and moisture from inside your home. Leave trickle vents on windows open and unblocked, especially when bathing or cooking. 2. Stop condensation. If possible, dry your clothes outdoors or in a tumble dryer. If this is not possible, then use a well-aired room, turn on your extractor fan, or open your trickle vents to remove moisture from the air. When cooking, cover your pans with a lid and use your extractor fan. 3. Keep your home free from cigarette smoke. 4. Keep warm by making sure your house is at least 18 degrees Celsius, especially in colder months. This will help to prevent damp and mold. Even heating your home at a low level can help stop the buildup of mold, which can be harmful to health.
5. Use electric or gas heating to heat your home rather than wood or coal if possible. If you are heating your home with a wood-burning stove, make sure this meets the required Eco-Design Ready standards and use clean fuels, such as the wood with ready-to-burn logo. 6. Have a professional service your heating and cooking appliances, including your boiler and your oven annually, as faulty appliances can emit dangerous levels of carbon monoxide. If you rent your property, your landlord is legally required to do this. Contact them if you have not had a recent service. 7. Vacuuming regularly will stop dust getting into your nose or mouth and will reduce irritation of the nose, throat and eyes. If possible, use a vacuum with a high efficiency particulate air or HEPA filter.
An image showing the 6 different VOC warning labels is shown. The labels range from trace to very high.
8. When buying your cleaning and personal care products, choose those that are labelled chemical-free, fragrance-free or allergy-friendly. The eco label on some products will tell you the amount of volatile organic compounds in them, also known as VOCs. VOCs can cause irritation to the eyes, nose and throat. Always follow the product instructions on paints, solvents and glues. 9. Ventilate your house whilst you are burning candles and incense indoors. Make sure you have a smoke alarm fitted on each floor of your home and test them on a regular basis. 10. When cooking, open your windows and close your kitchen door if possible. This will reduce pollution from the burning of oils and gas flames and will reduce condensation caused by steam. Keep your window open or extractor fan on for 10 minutes after cooking. If you are considering changing your kitchen appliances, consider an electric or ceramic hob rather than gas. How to get support to improve indoor air. What we do indoors, how we cook, clean and ventilate can provide us with a safer and more comfortable home environment. However, sometimes help may be needed to improve our living conditions to improve our health and well-being.
An image of a wall covered in black mold is shown.
Damp and mould. Condensation and mould is common in all homes. The best way to prevent this is 1. Remove moisture by opening vents, turning on extractors if you have them, and opening windows when cooking, bathing or drying clothes indoors. 2. Keep heating on at a low level to prevent cold surfaces. 3. Wipe down condensation that forms on windows, walls and tiles. 4. Treat any mold growth you notice straight away with a mold spray or a light detergent to avoid health hazards and costly damage. You can also watch a video for some top tips to reduce condensation, which can cause damp and mold. Search for Help to Prevent Mold in Your Home Housing Leads -YouTube in your internet search engine. If the damp problem gets worse or you aren't able to deal with damp and mold growth by yourself, then please tell your landlord. If you live in a private rented property, you should report any problems to your landlord, who will be able to take any action needed. Further information for private tenants is available at www.leeds.gov.uk/housing/help-for-private-tenants. The council may be able to help if the problem is caused by your landlord not making repairs that are causing or making any damp and mould worse. you can contact the private rented housing team on 0113 378 4699 or email prs.housing@leeds.gov.uk. If you live in a council property, you can report damp and mould by calling 0800 188 4000 or by emailing d&mteam@leeds.gov.uk. More advice for council tenants is available at www.leeds.gov.uk-repairs. Smoking. Smoking indoor causes poor air for you and everyone else living in the house. It also increases the risk of lung cancer and heart problems. Quitting smoking has several health benefits. To find out more and to receive support to stop smoking, visit www.leedsstopsmoking.co.uk. Keeping warm. The Energy Saving Trust recommends that room temperatures are kept between 18 to 21 degrees Celsius to prevent cold spots on walls indoors. Staying warm also has significant physical and mental health benefits. For help and advice on organisations offering affordable warmth grants, visit www.leeds.gov.uk/housing/make-your-more-energy-efficient. Leeds Welfare Rights will also be able to make sure that all appropriate benefits are being claimed and signpost you to any other services they feel are able to support you. If you would like to contact Welfare Rights, call them on 0113 376 0452. An advocate can ring on your behalf if this is easier.